Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this video, we're going to talk about the different types of anesthesia and different types that you can receive as part of your pain management for knee replacement surgery. Everyone, so today we're talking about the different types of anesthesia, pain management strategies for knee replacement. And so there's really two categories we can talk about. So there's general anesthesia, and then you're going to have regional anesthesia. And regional, you can get either spinal or epidural. So first, let's talk about general anesthetic. And this is basically the form of making your entire body unconscious. So unconscious, unable to feel pain, sensations, things going on. So this is administered through a breathing mask or an IV line, or maybe a combination of the two. There are some supposed benefits with this. It may cause less pain overall. It may cause less nausea and possibly a faster discharge from surgery. Then the other two options we'll talk about are your regional anesthetic. So this is the anesthesia is being put into your low back a little bit different ways and basically numbing your lower body and legs. And you can be awake with the regional anesthesia. Some individuals, a lot of individuals will request a general sedation to go along with the regional anesthetic just because of maybe nervousness, anxiety with being awake during the knee replacement procedure. So the regional can again be divided into spinal or epidural. So a spinal anesthetic is one single injection. It's a little bit smaller needle than the epidural. And this is going to put the drug right into your cerebral spinal fluid. So the fluid that is surrounding your spinal cord. Your spinal cord is obviously part of your nervous system, connects to the nerves that run through your legs and the rest of your body. So this is one injection right into the cerebral spinal fluid, the CSF, that surrounds your spinal cord. An epidural is a little bit different in that a catheter is actually placed and remains in place around the epidural space. So it doesn't go through, it goes through one less kind of membrane, one less layer. And it's in the epidural space and it remains there, and you can administer the anesthetic, the drugs, as needed throughout the procedure. And this is good that you can kind of monitor and adjust the medicine as needed. It might last a little bit longer as well. With both of these techniques, you typically are going to have a local anesthetic to the low back area where the injection is happening as well, just to help with pain relief in that matter. So some things to think about, which is better, which is worse. So traditionally, it was mainly always general anesthesia that was used through for knee replacement surgeries, but definitely the regional anesthesia is on the rise now. So the regional one has been shown in a lot of studies to have better outcomes, better decreased blood loss, decreased length of stay, decreased mortality rate, and overall less complications. And so a lot of people are now moving towards, a lot of surgeons, anesthesiologists are moving towards the regional anesthetic. There's also the availability of what's called multimodal analgesia, so typically using maybe like the regional anesthetic, so a spinal or an epidural, and then maybe combining that with a peripheral nerve block, and of course the most common would be the femoral nerve block to again help further with pain management strategies. So in general, different options. You can have the general, you can have general anesthetic that makes you unconscious, whole body. You can have a regional anesthetic, which is more specific to that region, your legs, your lower body. That could be a spinal or an epidural. A lot of times with the regional anesthetic, people may also have a sedation, so they're unconscious, they're asleep during the surgery, but not necessarily needed. You can be awake during the surgery and be alert as well. With the sedation, basically just puts you into this sleep, so you're not experiencing what's going on during the surgery. Not as powerful necessarily as the unconsciousness that you get with a general anesthetic. So that's the different options that are out there. Again, a lot of surgeons are moving to the regional or moving to the multimodal, so using the regional anesthetic in addition to a peripheral nerve block or femoral nerve block. So I'd love to hear if you have any questions, if you have any experiences with anesthesia, anesthetics. I'd love to hear what your thoughts are and any questions, so please be sure to leave a comment if you have any. Thank you very much for watching, everyone. This has been the Need to Know Show. Have a great day.